High functioning anxiety. Yes. Okay. I know exactly which one you're talking about. Okay. So high functioning anxiety is such an interesting phenomenon. And really what it presents as is somebody who looks super calm, confident on the outside. And this is often the kind of person that people think is okay. And very rarely will somebody check in and be like, hey, are you okay? I've noticed a change because they look super composed on the outside. But inside, there is such a high level of anxiety, of internal pressure, of it never feeling good enough, constantly chasing something. And the moment you obtain it, there's no, or if there is, it's very fleeting, a moment of celebrating, of absorbing that. It's a constant chase. So a lot of this happens on the inside, and they might look super chilled on the outside, but inside they feel like they need to have everything planned, everything needs to be controlled, because that's a way to manage their anxiety.
Hey everybody, welcome back to another episode of the Expect Performance podcast. And I've got a question for you today. Have you ever experienced anxiety? I strongly suspect that the answer is yes. And in today's day and age, it is becoming more and more prevalent, it seems. So if you answered yes to that question, then I strongly suspect that this episode is going to be interesting for you, because I have registered counselling psychologist Dr. Angelic Nespola on the show with me today. Ange has a master's in psychology and a doctorate as well in psychology, so she is very well versed in treating disorders such as anxiety, but not limited to. And has also appeared on your TV screens on the famous show Espresso, as well as various radio segments where she is based in Stellenbosch. But today's episode is all about anxiety. We cover things such as the difference between anxiety and nerves, the difference between anxiety and depression, the difference between anxiety and anxiety disorders. What are the symptoms of anxiety? How best do you manage relationships with people that have anxiety, or where you might have anxiety? And of course, what proactive measures can be taken to manage such symptoms and such disorders in a productive and proactive manner? This is a very important episode because I think mental health is something that needs to be addressed on a more regular basis and needs to be spoken about and tackled head on. Please like, share, subscribe, and enjoy. Angelic, welcome to the Expect Performance podcast.
Thank you so much. Thank you for having me.
Absolute pleasure. I say this every episode, but for me, my personal journey, I've had exchanges with anxiety in the past. And I know that this is something that's going to resonate with a lot of people, even before we've entered this discussion. And you have an area of expertise in that area. So before we get chatting about anxiety, can you give me some context for your career and then how you find yourself where you are at the moment?
Yeah, so I am a counselling psychologist. I'm registered with the Health Professions Council. I have my doctorate in psychology and my master's in psychology. I work in outpatient settings, so in private practice. I'm based in Stellenbosch. And then I also do some inpatient work in clinical settings.
So we're on this podcast today to chat about anxiety. And I think the best place to start would be to define it. So what is anxiety? And then we'll branch off from there into the different types or differentiating between anxiety, depression, nerves, etc.
Yes, I think that's important. So anxiety is a feeling of fear, it's a feeling of stress, it's a pervasive worry that persists. Okay. And I think maybe here I'd also just like to identify an anxiety disorder versus anxiety. So somebody can experience anxiety here and there. That doesn't make it an anxiety disorder, right? An anxiety disorder is when you experience the anxiety for most days, more days than not, for a period of 6 months. That would make it a clinically diagnosed anxiety disorder where it's affecting the different areas of your life. Okay, so there's that. But for the purpose of our discussion, let's just talk about anxiety. So it's that fear that comes up. It's that persistent worry that might be related to something, or it might be related to nothing in particular. And it can present in our bodies, and it's different for everybody, but it can come with that increased heart rate. You just feel like your heart rate is persistently high, sweaty palms, stomach in a knot, muscle tension. So I think it is important to acknowledge the physical presentation of anxiety as well as the emotional aspect of it.
Okay. What are the different types of anxiety, if there are?
Do you mean disorders or?
Yes, disorders.
Yeah, so the main one that you'll often maybe know about or hear about is a generalized anxiety disorder. So that is when we don't have anxiety in relation to a specific stressor. Whereas we do have things that are associated, anxiety disorders that are associated with a specific thing. We can think about claustrophobia, all our phobias that are related to a very specific trigger. A generalized anxiety disorder is not associated with one particular thing. The person constantly feels anxious. And then we also get our panic disorders, where there's the presentation of a panic attack in association with the anxiety.
Okay. Can you tell me, what is the difference then between depression and anxiety? Because I think sometimes people lump them all together. Like, I'm an anxious person, I'm a depressed person. It's like negative emotion, But there's a difference between the two. Can you elaborate on that, please?
So both anxiety and depression are mental health conditions. And often very often in practice, we'll see that they do co-occur. And we could go into a debate as to what comes first, the depression or anxiety. And it would be different for different people, chicken or egg. But the difference that I think, if we had to go down to the fundamental differences between the anxiety and the depression. So depression often presents with a low mood, a hopelessness. It can also present with irritability. It could affect your sleep. And a big one is a lack of interest in aspects that you used to enjoy. Okay, so it really comes with that low mood. And there are the physical aspects as well, sleep, appetite, that can be impacted. When we look at anxiety, the difference there is this consistent fear that the person sits with, this pervasive fear that is out of proportion to the experience that they're going through. There's not necessarily a trigger. They're just consistently feeling incredibly, incredibly anxious. There's a nervousness. There's a fear. So if we had to kind of put the main differences down, it would be the mood aspect. Depression, really low mood. Anxiety, this nervousness, this persistent fear. But you can have both at the same time. But if we had to kind of tease them apart, that would be the defining thing we'd look at.
Okay. Very, very interesting. I saw a post of yours on social media. You're quite prominent on Instagram in particular. High performers or anxiety. And that was something that resonated with me to a certain degree, because I work with a lot of high performers in my gym. So people with disposable income, business owners, elite athletes, etc., etc. And running through the list on that post, I was like, tick, 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 tick. So can you elaborate on what that is, and what are the symptoms? How does that manifest and present itself?
High functioning anxiety. Yes. Okay. I know exactly which one you're talking about. Okay. So high functioning anxiety is such an interesting phenomenon. And really what it presents as is somebody looks super calm, confident on the outside. And this is often the kind of person that people think is okay. And very rarely will somebody check in and be like, hey, Are you okay? I've noticed a change because they look super composed on the outside. But inside, there is such a high level of anxiety, of internal pressure, of it never feeling good enough, constantly chasing something. And the moment you obtain it, there's no, or if there is, it's very fleeting, a moment of celebrating, of absorbing that. It's a constant chase. So a lot of this happens on the inside, and they might look super chilled on the outside, but inside they feel like they need to have everything planned, everything needs to be controlled, because that's a way to manage their anxiety.
Okay. Is that necessarily a bad thing? So can we channel anxiety or fears in a constructive, positive manner to reach our goals or to push us away from things that are destructive?
Yeah, because I think we do have to recognize a little bit of performance anxiety can stand you in good stead, right? It can help you prepare for things. It can help you preempt issues that could come up, and you find yourself managing those because you've prepared for them. So there is a way to channel that. The same with having goals. Goals are really important. Having structured goals, having goals that are attainable, that's important. But to be aware of that line, that threshold that it can cross, where the anxiety is associated with a performance anxiety, where you're chasing something to obtain a sense of worth and value, because you're never going to, it's never going to be enough, right? There's this constant chase. And with that is this fear of failure, because if I fail, then who am I? What am I? I'm nothing without that. And often we see this in super high performing people, that it can serve them well. But there's a point where the wheels can fall off, and it puts you at risk of, because you invest your identity and your worth in your performance. Because you're high performing, everybody, often mentions that, you've done so well in sport or whatever it is. We're so proud of you, and you're known as the person who plays this position in the rugby team, or you're this kind of athlete, or you're an academic, whatever it might be. Everyone speaks about that. Everyone affirms that, which is great. But it becomes integrated into our identity, and that's where the wheels fall off. So yes, ambitions are wonderful. Having goals, being driven to perform, it's wonderful. But be aware of that threshold. Be aware of, what are you chasing? Is it for worth? Because that's a dangerous game. Or is it for passion? The drive behind that is very different, if that makes sense.
Yes, that makes perfect sense. And I think that's quite pertinent to my athletic clients, especially golfers, because I work with a lot of golfers.
Yes.
And the saying I use is, you're not the number on your scorecard.
Sure. That's powerful.
Because if that is your core identity, right? I'm a golfer. I'm not a father. I'm not a husband. I'm not a friend, a son, a brother, whatever. Then the days when I play good golf, it's going to be great. Yes, but then what are the days inevitably when things don't go according to plan? And that's when you say there's that all fall down. Because now it's like, okay, the very thing that I thought I was, this week I'm not. So then what happens next? And then I think that's where anxiety is such an issue, and how it can get out of control, because there's a multiplicity of different pathways that it can go down. Because then, okay, if I'm not a golfer this week, then what am I? Okay, well, if I'm not a good golfer, well, then that means I've got to dig deep and look into, okay, who am I as a person? That's maybe something that I haven't done for a few years. And then it's like, oh, I've left a lot of stuff under the carpet.
Yeah.
Am I a good father? Am I a good husband? You can then, it can go into any different direction that can be relevant or completely ridiculous, right? And that's where anxiety becomes an issue, because how much of it is actually justified?
Yes. And there's this constant anxiety then to perform and to succeed, because when you don't, that feeling is so awful. So your performance is driven by something very different to a love for the sport, a love for the game. It feels incredibly threatening to not perform. And then there's this constant pressure that accompanies that.
Yeah. And then, like you said, totally not sustainable.
Yeah.
All right. So then we're in a collective space. We're either in a team that are working towards the benefit of an athlete, or maybe you're in a corporate space, you've got colleagues and peers, maybe even you're at home.
Yeah.
You've identified that there's somebody in your close circle that is starting to show symptoms of anxiety, and on a repetitive basis. How should one go about dealing with that person for the betterment of that individual, obviously?
When you say dealing, and how you should approach them or how you should help them? How you should engage with them, or is it how to support?
How should you engage with them? And then support them. So let's say that's a two-parter. So engage first, support second.
Okay, I'll speak to both. It's a difficult one because it really depends on so many aspects. It depends on the setting that you're operating in, and it depends on the severity of the anxiety. But I think to be aware of it is the first thing, which this person is obviously demonstrating. And then to look at the caseload, what are the pressures that are on this person? Let's take the work setting. I think that's something everyone can maybe connect to. So you have someone in your team and you've noticed they're starting to show signs of anxiety, they're not quite okay. So then just zoom out, look at all the pressures on them, look at what maybe can shift. But I also think having a conversation with the person, asking them what do they need, because what you need and the next person needs is not the same. So maybe the one person needs slightly less tasks and the other person needs different tasks. They don't want to be behind the desk. They want to be interacting with more people. That's going to help them. So I think to have a conversation, and not in a way, not in a condescending or a way that you assume, but rather in, I've noticed you're not yourself, you're struggling. How can I help? What is it that you need? Not to make assumptions about someone's needs is really important there.
Yes, I think that's crucial, because sometimes we can be guilty of thinking, okay, what would I want in that scenario if that were me? And then thinking that that's the best way of helping the other person.
Yeah, absolutely.
And sometimes it might make the problem way worse.
Yeah, because one person's needs is something another person is maybe trying to avoid. One person might not want too much social interaction when they're feeling anxious. Another person, that's their way to work through it. So that's a good point you make.
Yeah. So if I think of me, if I'm feeling overwhelmed, maybe a bit anxious in the moment.
Yeah.
If somebody asks me a question, let's say, and I will shut down for like 2 or 3 seconds. Just means that literally, I'm gone. I don't know what you're saying. Can you please repeat that? Because my mind is like, for 3 seconds, it's just absolutely, I don't know what that person said. It's just gone in all different directions. And then I just need to take a step back. And then sometimes it looks actually like I'm not listening. But it's not that I'm not listening. It can be interpreted as that. But it's just me feeling very overwhelmed in that space of like 3 or 4 seconds.
Yeah, and I suppose you make an important point there that somebody might be overwhelmed. There's a sensory overload, so they shut down and they might not respond immediately. So to maybe say something like, take some time, go home, think on it, just know I do want to support, so come back to me. So to keep that in mind, that they might not be like, oh, thank you for asking. Here's my list of needs. Work out my list.
Yeah.
They might need time. And that is something that comes with anxiety, those things that you mentioned, where the brain shuts down for a little bit. It looks like the person isn't focusing, isn't engaging. They might ask you to repeat themselves, and that often goes back to anxiety. So understanding anxiety, if you have people in your life, and you do, I think, like you said, anxiety is very present. Educate yourself a little bit on anxiety, what it feels like, how it can look for different people, so that you can understand a response like that, for example.
Yes, exactly. And then you can be the best possible support for that person, number one. And number two, if you start to have a better understanding of how things work internally within yourself, you can then start to look at, okay, what are the tools that I can use to better my current situation?
Yeah, absolutely.
So tools. How does one begin to alleviate symptoms of anxiety, to build sustainable habits that are lifestyle oriented, to make sure that this doesn't get out of control?
Yeah, I think there are so many factors, and I like to think, when I sit down with a client, I like to draw a circle and kind of look at the different areas of life. We can't just focus on mental health or physical health or nutrition, or, we need to look at everything quite holistically. So I think starting there, looking at the different areas of your life, looking at your exercise, and I'm not saying everybody has to train, on a hectic training routine, but find some sort of exercise that works for you. It can be walking. It can be any gradual form of, stretching. It doesn't have to be a hectic exercise. But if you are an athlete and you found something that works for you, great. But check in and see, does this help? Looking at your nutrition. So the research on this has been super, super interesting. I think the research has shown something between 90 to 95% of our serotonin, that's our neurotransmitter that helps with balancing the mood, is produced in the gut. There's a big link between gut health and mental health. The health of your gut has a big influence on your mood, on your anxiety. So that's something interesting to think about as well. Other research about, coffee, and don't get me wrong, I love a good cup of coffee. I'm Italian, love coffee. But there's some research that shows drinking coffee, I think it's in the first hour of the day, spikes your cortisol levels, and it can leave you feeling quite wired for a long stint into your day. So there are things like that. Your sleep is super important to anxiety. So that's what I mean when we look at your life holistically and the different aspects of your life. Looking at that, thinking on each one, thinking what can we tweak, what needs to be readjusted entirely, is a good starting point, I'd say.
Yes. So to your point about the coffee, I'm glad that I edit this after the fact, because I'm definitely taking that part of the coffee cortisol levels out, because we are big fans of coffee, yeah, and myself too. So I'm going to edit that part out.
But yeah, no, but I think it's more about not drinking coffee. I mean, it's just about understanding how your body responds, being aware of what happens in your body. So noticing, okay, when I do drink coffee in the first hour, I am a little bit more anxious. I'm a little bit more wired. So I suppose the point I'm making is to be aware of factors in your life that are within your control, and how your mental health responds to that, how your anxiety responds to that.
Yes. So if I use myself as an example, once I get to my third coffee, very seldom will I get to 3. More than often it's 2. But if I've had 3 coffees and it's still the morning time, then I start to feel a little edgy. I can definitely feel it. It's like, I almost feel like my heart rate just elevates a little too much. and just a bit like, yeah, wired. So I think it also depends on the individual, how well you metabolize caffeine, because that's another big thing. Some people can have caffeine like late in the afternoon and they can go to sleep and they're absolutely fine. Other people have a cup of coffee at 3, 4 in the afternoon and they're wired until 10 o'clock at night.
Yeah, absolutely. So I think to be curious about the effect, we're talking about coffee now, the effect of coffee on your internal state of being is important.
So when people come into the gym, I do what I call a lifestyle audit. So literally loads of questions on the lifestyle, medical history, how well do you sleep, how often do you sleep, what do you eat, what's your relationship like with stress, does that impact your decision making with respect to your eating, your sleeping, your drinking, your smoking, the works. And in my 12 years working in fitness, when it comes to mental health in particular, there's 4 things that I've noticed, all backed by research, that people need to have to give themselves the best possible chance of being mentally fit. And the first one is exercise. Literally, you work out, you do anything. It could be a walk, whatever, like you've already alluded to. But it's immediate, the benefit. There's a decrease in anxiety, your feel-good hormones are elevated, etc. So you might have a problem before your walk or your gym session. You sit on it for half an hour, you exercise, you come back. You might have come to a completely different answer to the same problem just because your state has changed, your physical state. And that's the powerful thing behind exercise. The second thing is diet. Yes, so we've spoken about gut. I'm glad that you alluded to that with serotonin. So your diet, what are you eating? People don't realize how much of an impact that can make on your mental health. The third thing is mindfulness. So what kind of mindfulness practice are you doing on a regular basis? So that could be prayer, it could be meditation, it could be mindfulness walking, just trying to be in the present moment. And the final one is sleep.
Yeah, consistent quality of sleep.
Yeah, because I find myself, we've both got little critters running around.
Yeah, little humans.
Yeah, and sleep is not what it used to be. And I find that definitely I'm more prone to negative thoughts when I'm sleep deprived. And is that something that is backed by evidence? Have you noticed that in yourself and then in patients?
Absolutely. I mean, the research is definitely there to show that consistent sleep is a big part of anxiety, but on mental health in general. And it very often is one of the first things to kind of fall apart when mental health becomes strained. So it might be the quality of sleep. Maybe you're getting the right amount of hours in, but your quality of sleep is really poor. You're waking up very tired, or you're struggling to fall asleep. Eventually you do fall asleep, but it takes a long time, or you find yourself waking up in between. So this is often something that tends to be one of the first things that crop up when mental health is not at optimal level. And it is something that can further fuel the fire. Like you say, you are not functioning at your optimal, as yourself. Your brain also needs sleep to be able to function. You're more irritable. Everything is just affected by that. insomnia is a terrible thing to suffer with. It's something that can leave a person feeling really out of control and have this knock-on effect.
I read a book called The Gulag Archipelago, and it was in the early 20th century. The Bolsheviks and the Red Army and people were basically being put into concentration camps for conspiracy against the state. And even if you knew somebody who was supposedly conspiring against the state, you would go and you would be put in these concentration camps. And the author was in one of these camps. And he said, without question, the worst form of torture when they were in those camps was sleep deprivation. He said, but without question, it was the worst.
Physical and the mental effect, the emotional effect. I think it just affects the whole system, your whole system.
Exactly. So my 4 pillars for mental health, those 4, okay. So that would be conservative treatments for any kind of lack of fitness, shall we call it, mentally.
Yeah. I think if I could there was one thing I wanted to just add to, we spoke a little bit about nutrition and we spoke about because I'm very much about what does the research say. Another thing to look at within the umbrella of this pillar of nutrition and the gut health, the mind-gut axis, is alcohol. How is your alcohol consumption affecting your health, your anxiety levels, your mood? We know that alcohol is a depressant. It does affect your mood. So to be aware of that, I'm not talking in the moment. I'm sure when you're drinking, you're having a good old time. Observe what your body feels like, what your emotions feel like in the days after.
Yes, I think that's a crucial point. And also it's not only the fact that it is a depressant for the most part, but it affects your decision making on all those other 4 things too, right?
Yeah. The next morning you won't go train because I'm not feeling great. And then because you didn't train, we kind of slip a bit more. So yeah, there's a little bit of a vicious cycle that plays out there.
Yeah.
But we do know that there's this link between your central nervous system and your gut. There's the mind-gut axis. And so to just be aware of that.
Yes. More affirmations of you are what you eat.
Yeah. And at least it plays a role. I mean, none of these, that's why I like how you say they're pillars, they're part of the puzzle, part of the picture. So they all influence each other, but it's not just one thing that we need to look at. I think that's always important.
Exactly. So let's chat about the next form of treatment when it comes to anxiety. And there really has been an epidemic, particularly in the States, with the opiate crisis. So Xanax and the likes.
Yeah.
Benzodiazepines in particular have become quite a topic of controversy with respect to administering them, how long you take them for. Are they going to do more harm than good because of the addictive nature of that medicine? Do you have an opinion on treating anxiety medicinally?
Yeah, so there's a few things that come to mind. The first one, is seeing a psychiatrist for the treatment of your anxiety, because a benzo is usually used short-term for the short-term alleviation of anxiety. When you're starting to use that long-term, you're not using the drug correctly. And psychiatrists have studied years and years and years their knowledge on the medications, on the interactions, on your body composition is incredible. So if you are going to go that route and your psychologist has recommended, or you have been on it but it's not working, to really consider seeing a psychiatrist. Get the professional input. Because I think sometimes someone is prescribed a benzo and they just keep taking the benzo. Like you say, there are dangers associated with that. So for it to be prescribed by the healthcare professional whose focus that is, and to take it as directed. I think that is important. But I do want to say that very often you need to have a holistic treatment. You can't just take a pill and expect everything's going to fall into place. You also need to boost it with the therapy, with coping mechanisms, with other tools, with the mindfulness you spoke about. So yes, meds have a place. Meds are, if somebody has a clinical diagnosis and it makes their life better, it definitely has a place. But I think my problem is where it's not prescribed by someone like a psychiatrist. Like you say, I used to work in a rehab. So I've seen the effects of a benzo addiction. And it's hectic. It's really beyond what I think most people realize. Even pain meds, but that's a whole other story. But a benzo addiction and a benzo detox is incredibly hectic. And that just tells us a lot about the substance. So you need to understand what you're taking. You need to do research and you need to see the right people. I think that's kind of in a nutshell what I'm trying to say.
Yeah. Is it true that you can't go cold turkey on a benzo addiction?
So often if you and that's why you'd be admitted into a clinic and you'd go into a detox period and your doctors will assess you, and detox can be dangerous if it's not done under the care of a medical team. So often in treatment, you will have a GP on your case and you will have a psychiatrist. And of course, you've got your nurses there, you've got your psychologists, but your psychiatrist and your GP will put you into the detox. And sometimes it can be a medical detox because if you go cold turkey, it's very dangerous on your body. So you'll go into a detox period where it's very closely monitored and the effects of your body are monitored. So yeah, it can be very dangerous to just do it by yourself. So to get that support is important.
Okay. Ange, you've decided to actively pursue rather a role on social media through education. Okay. That's what brought me essentially to this podcast episode, this recording, as I came across your content and I started to go through it and it was all making a lot of sense and it was very healthy and informative information for people. But at the same time, I'm torn with social media because there's so much that I don't like about it. And the instant gratification, the fact that you attach your people rather attach their worth to how many likes or views they get, the fact that you are more likely to compare yourself to other people, that is not a reflection of reality. All of these things are contributing factors in why I get quite nervous about social media, and that's purely because I'm prone to those things. Do you have an opinion on social media and the pros and cons around it?
Yeah, so let's maybe start with the pros. Because I think with any tool, anything out there, there's a lot of aspects that influence whether it's a positive or negative in your life. I think social media is something that has brought a lot of connection. We connected through that, for example, support, communities form. There's a lot of information on mental health and so on. So there's a lot of good there for sure, but there are a lot of dangers as well. So the one thing that I thought about when you were asking your question now is, and we know this, social media promotes an idealized image. But what that does for a lot of people is comparison, comparing yourself to an idealized image. And what the implication is for self-worth and self-value can be really, really difficult for a lot of people to go through. leaving them feeling inadequate. So that's one thing. Another thing that is a worry is the cyberbullying. People being able to say what they want to people with very little consequence. I think if most of us are honest, when somebody attacks you, it's very difficult. It is really, really difficult to, even if you're in a good place and your self-worth and your self-value, it hurts to different degrees, right? It stings, and the sting is, to different degrees. But that is a problem. The comments that people make and the attacks that people make on people is problematic overall, but it is problematic for mental health.
Yeah. Have you been the subject of such disparaging comments as you've grown your following?
No, I have not myself, but it's something that we often hear about, and it is a reality out there. I'm not sure if it's something you've encountered, but it's just something that more and more you see it, you hear of people going through it, and it's not okay. Is it something you've dealt with?
Not to a large degree, but once or twice. So I'll demonstrate an exercise, for example, give a breakdown about why it's important, etc., the demonstration of the technique, and somebody's come on and they've said, this is a terrible exercise, this guy has no idea what he's talking about, blah, blah, blah. And then you're okay, so how do I respond to that? Because you want to save face, but at the same time, you don't want to add more fuel to the fire. And then you go and you check this person's profile, and invariably they've got no posts. They follow 3,000 people, and they have 15 followers. and then you look at it and you're like, okay, this is probably somebody that's just very disgruntled and sad, and it's actually got no reflection on me whatsoever. But yes, there's that immediate emotional, like, rah, how can you say that? And you want to engage with that person and prove them wrong. But you've just got to let that go, water off a duck's back. And that's what comes back to self-worth, right? You mentioned that earlier. If you know that you're driven by something that is sustainable and that has a purpose, and you're contributing positively to society the best way that you can, then those types of comments will just go by the wayside.
Yeah. And I think often if you're in the professional space, that kind of protects you. You're a professional on Instagram, I'm a professional. But it is still hard, for your professional qualifications to be attacked in that way. But there are people whose personal lives are being attacked, and that also hits sore spots. So I think there's so many different layers to this, and it is a danger that comes with it, and something that's not okay. I do also think a lot of people are recognizing that and standing up against it, which is a good thing. So that's one of the things that worries me about, the effects of social media, especially our youth, our adolescents. Think about them. They're still in a stage where their identity is being formed and developed. You and I, our identities are already solidified, we've gone through that, but they're still forming their identities, and this feedback that they gets integrated. So that worries me. There's that. Then another just branching off slightly is the information overload that comes with social media. And for some people this is okay, but to be aware if somebody is struggling with anxiety, or times where you're feeling more anxious, be aware of how this constant influx of information is making you feel. And be aware of the accounts that you follow. How are they leaving you feeling? Are there wholesome spaces for you to access? Or do they keep bringing up feelings of insecurity? Is it constantly bad news and you're not metabolizing that well right now? Not saying you don't want to be informed, but you might decide, okay, I'm going to read the news at a time that I'm deciding to read the news, not just have it, coming at me whenever I open my phone. So, it's different for everybody, but to be aware of that constant information overload, and also having your phone all the time, being available to people also can feed into anxiety. So those are some other thoughts that come to mind on that topic.
Yeah. And building a following on social media also requires time and effort. So it requires curation of content. It requires consistent application and consistent posting, which you've done very well at this point in your career. What is your relationship like with social media personally? Because to grow that following must be quite time consuming.
Yeah, I think it started with the recognition that mental health conditions in our country is, if you look at the stats, in South Africa, we have a high percentage of mental health conditions, very low percentage of psychologists. We have a shortage of psychologists in our country. Beyond a shortage, psychologists are not easily accessible. Unless you're on medical aid or you are privileged, not everybody can access mental health care easily. Yeah, there are organizations and they are doing incredible work, but it's not accessible. That is the reality in our country. And with that is a stigma around mental health and psychology. And how long have I been registered for? I think it's my 6th year of being a qualified psychologist, and it has started to shift the stigma around mental health, but it's still very much there. And so I wanted to make a difference on a bigger scale. I wanted to speak more about psychology. I want people to see that psychology relates to every human being, different aspects of it, but it's not just for people who are clinically diagnosed. There are aspects that can relate and can help everybody. So that's been my goal and my vision. Yes, it takes sacrifice. I do a lot of media contributions where I can, podcasts like this. It's time I have to take out of my work day, but it's important. These conversations are important. These dialogues are important. And I firmly believe in that. So it's something I'm willing and I want to dedicate my time to have conversations, because it doesn't help that I just complain about how it's stigmatized and not understood. I want to open dialogue, and I want to. It's so cool that we can connect. You're in the sporting industry and the high performance industry, and we can, do a multidisciplinary discussion. It's super cool. So that's been my focus and why I do it. Yes, it does take time, but I enjoy it for those reasons.
Fantastic. Bloody brilliant, actually. So, Ange, I want to draw your attention to an author that I pay particular interest to, a psychologist, Dr. Gabor Mate. He's a Canadian psychologist. He's written some incredible books like When the Body Says No, The Hidden Cost of Trauma.
Okay, yeah.
And he speaks a lot about anxiety and the roots of anxiety. And I suppose in this instance, we're talking about anxiety disorders. And he believes that to a large extent, anxiety can be rooted in our early development as people. So let's say, for argument's sake, the first 2 years, as we are really developing, we both have young families. And obviously there's a relevance to that in terms of all we talk about is our baby, right? And what's the best way to bring him up? What's the best way to raise him? What should you feed him or her? How should you sleep train them? Should you not sleep train them? And I wanted to ask your thoughts on exactly that. So what do you do with your baby with respect to when they cry, what do you do? Because some people, they leave them to cry as a form of sleep training, etc.
Yeah, so just a little bit of a backstory. When I became a mom, so obviously I have all the knowledge. I mean, it's all there. I've read all the textbooks. You know, I don't work with children, so it's not my area. But I had to study it. You know, I had to have the child psychology info. But when I became a mom, I had to go get my child psychology textbook out because it was so different. The literature is one thing. But when you're there in the here and now, it's a whole different thing. So I kind of had to relearn my psych knowledge within the context of my new role as a mom. So that was very interesting. So what I'm about to say now is not my clinical it's not my clinical input. It's more as mom. So what I then realized is that what it then came down to for me was connecting to what feels right for me, what my maternal gut instinct is and needs. So one thing that is very clear in the psychology literature is being attuned, being responsive to your child's needs. If you look at attachment theory, and if there are any parents on here, it doesn't matter if you're a new parent, an established parent, attachment theory is super, super fascinating because if you get that attachment right with your child, that sets them up for good mental health, for the rest of their life. So that those early years are one of the important factors, not the only, but it is a very important factor if we look at the literature. And what that comes down to is being attuned to your child's needs. And there are different aspects that kind of come into play there, but it is being responsive. And part of the literature, very interesting, is the dad's role in supporting the family system, supporting mom so that mom can provide that emotional holding. That's the psych word. It's an emotional holding environment, a sense of safety for the child that gives them the confidence to explore life and explore things in their later years. But dads play a really important role. And on a side note, it's been very interesting, and I'd be interested to hear your opinion on this, to see the involvement of dads now, the last few years, how involved they are. There's a definite shift in that. And I've been thinking about it and I haven't quite made sense of it. But it is beautiful to see. It really is beautiful to see that dads are changing nappies. Dads know what time, is nap time. Dads know, about the medical care, who's the pediatrician they go with to the pediatrician. There's a shift. And I'm curious if you've noticed that. Have you thought on that? What comes up for you?
Yeah. So what I've learned, firstly, it's impossible to talk about my baby boy without grinning like a Cheshire cat. I've got my roles that I really look forward to. It's really like the favorite part of my day now. So I work long hours being at the gym, but when I get home, it's bath time. So my thing is bath time. And I'll feed him his bottle before bed. And generally speaking, I'll get him to sleep. And then that's my time with my boy for the day. And if for some reason I can't get back in time for bath time and whatever, like it bums me out.
Yeah.
Because that's my bonding time. Yeah, exactly. And yeah, I fully subscribe to what you're saying. So I've been to the appointments to the ped. Often when we go and we walk on the promenade here in Durbs, I'll have the carrier on my chest and he'll be strapped to my chest and we'll be striding up and down the promenade.
Yeah.
And no, I absolutely love it. So I think that that role has definitely changed for the better.
And I'm not sure why. I mean, there's a lot of, I had this conversation recently with a friend to try and understand why it's changed, why dads are more involved. And I think that would be a very interesting field of study. But for whatever reason, it is beautiful to see. And I think if we look at the literature, that support and that involvement in, supporting mom, but also being present for the baby, attending to needs, putting baby to sleep, giving bottle, all of that is attuning to baby's needs. That solidifies your bond with them and your attachment. It's a safe space for them. So I'm glad you've also noticed it and can confirm my theory. But it is beautiful to see.
Yeah. What a wonderful way to finish. Now I'm thinking about my son. Ange, where can people find you? You've got some great content that I've alluded to already. You're available on different platforms as well with radio. You're on TV recently. So where can you drive them to go to your website, to your Instagram page, other social media handles, etc.?
Yeah, so you can find me on Instagram at Dr. Angelic Nespola as Instagram, and then I also have a website, so www.angienespola.co.za.
Wonderful. I'll include that in the show notes, and I'd encourage people to go and take a look at the content you're putting out. Very wholesome and very constructive.
Thank you for that. I really appreciate it.
Pleasure. Ange, take care. Thank you so much for your time.
You too, Clinton. Thanks so much. Bye.
Pleasure. Ciao. Not so fast. It is such a cool feeling when I see that Spotify subscribers number increase on the weekly, when I see the number of people listening to the episodes going up, and it really makes a huge difference. Have you ever done something and you feel so good when you get rewarded by some positive feedback and you really feel like you're making a difference? That's what it means to me, and that's how I feel. And it goes a long way if you like the show, share it and subscribe it. Thank you humbly, and I'll see you next week.